Ladies and gentlemen, would you please stand as we welcome the faculty and administration of the College of Dental Medicine. Ladies and gentlemen, please welcome the graduating class of 2018, led by Faculty Assembly Chair Dr. Jay Boschman and as Marshal, Associate Dean Dr. Nikki Kimmis.
It's become a tradition now. What a beautiful day, isn't it? Thank you all so much for coming. Spring, this is the first day of spring in Maine, if you don't know. Trees are starting to get green, and it's more green in here, I think, than outside. So good afternoon, good morning, sorry. I'm Dr. John Ryder. It's my honor to serve as Dean of the College of Dental Medicine. And I'd like to welcome you all to the second College of Dental Medicine commencement ceremony in honor of the class of 2018. I'd also like to welcome some special friends and supporters of the college, UNE Board of Trustee members, members of the local dental community, members of the Maine Board of Dental Practice, and Maine Dental Association, faculty, staff, and administrators. Oh, sorry, I'm supposed to tell you you can sit now. Please be seated. That was not on my script. I didn't write it in. Sorry, now I've lost my place. And for the first time, I'd like to welcome the UNE College of Dental Medicine alumni from last year. I would like to especially thank all the parents, grandparents, spouses, children, extended family, friends, and students, not only for being here today, but also for your support of your graduate of our college. I think it's important to recognize parents and family members that are dentists, physicians, and those that have achieved high levels of education and were able to serve as role models and mentors to their student. And I think it's equally important to recognize those parents and families who have graduates that may be the first in their family to reach the doctoral level, and the hard work, inspiration, and support those families have also given to their new graduate. Could I please have all the family members stand and be recognized? Thank you. Thank you to the students for choosing UNE, for your dental education and your support for each other through thick and thin. I've said many times that if I were in a class of one, I don't think I would have made it through dental school. It's the support and encouragement that you have for each other that can make a difference between succeeding or not. Dental school is very difficult, and navigating a new dental school curriculum that can sometimes change unexpectedly, new faculty and staff, and rule changes can add to your stress. So thank you. I'd also like to thank the heart and soul of our college, the talented and dedicated faculty and staff that have come to us from around the world and who have provided the knowledge, skills, wisdom, and opportunities for students to learn and become an outstanding healthcare professionals that I'm convinced they are. Could the faculty please stand and be recognized? I just want to take a minute to recognize one particular special faculty member that means a lot to all of us and who is retiring this year. Dr. Linda Bond has been in education a long time. With her wisdom, kindness, passion, and commitment to the education of our students and development of our school has been felt by all of us. Her presence will remain in our culture long after she goes home to Virginia. Linda, we have a little gift for you and a lot of love and appreciation for all that you have done. Thank you. Now she's going to make me cry. As the dean, I am the person that signs the diploma and has the final say of who graduates or not. One of the things that keeps me up at night is the responsibility of certifying every student is now ready to begin the practice of dentistry and that they have learned enough to be a competent beginner. In case you're wondering, I did sign all of your diplomas. I have the highest confidence in each and every one of you that you will not only graduate as a competent clinician, but that you will be all ethical, caring people who just happen to be doctors. I'm humbled to be serving as dean and to be the one to help facilitate today's event. And at the same time, I'm very cognizant of all the hard work and planning by so many visionary and dedicated people that have created our college and ultimately made this event possible. Many of those people are in this room today. They blend with the families of our graduates, all smiling as we are all proud parents today, delighted and amazed with our child as she is born and grows, finds his place in the world, and contributes to society. Our college and its graduates embody the mission and passion that is our culture. They now have a purpose not only to be excellent doctors, but also to be socially responsible, publicly engaged, and transformative leaders. Class of 2018, you must hold tight to your ethics and express your values through collaboration, inclusiveness, tolerance, empathy, and commitment to a lifelong learning in your profession. You will use what you have learned to work in a complex and ambiguous world where we may have the medicines and the procedures to treat a wide variety of diseases, but where millions of people don't have access to those tools. You will need to utilize all of your knowledge and the best possible technology to successfully treat your patients. But at the same time, you must take the time to make personal connections. While treating the immediate causes of disease, it will be your mission to understand and address the personal, geographic, cultural, and psychological causes of disease as well. And it is now your professional obligation to improve the oral health and extend the quality of life to people in your communities. All of you are going to make a difference, and a difference is what the world needs today. Thank you. It's now my privilege to introduce today's keynote speaker, Dr. Kathy O'Loughlin, is the Executive Director of the American Dental Association, the nation's leading advocate for oral health. She is a nationally recognized leader in healthcare, nonprofit, and education sectors. And she speaks around the country about the profession of dentistry, oral health care delivery, public health, dental practitioner, mental health and wellness, interprofessional collaboration within healthcare delivery, and the needs for diversity within the dental profession. She has broken the glass ceiling, and she is the first female dental school class president and valedictorian of Tufts University School of Dental Medicine, and is the first female executive director of the American Dental Association since its founding in 1859. Please join me in welcoming Dr. Kathy O'Loughlin.
Thank you. So I want to especially thank Dean Ryder and the faculty and all of you for inviting me here today, and especially the graduates of the class of 2018. Congratulations. Commencement is a turning point for most people, and like other major milestones in our lives, like getting married or buying a house or finally landing tickets for Hamilton. It's also sometimes called a pregnant moment. And a couple of you in the audience will know this story because you were my dental school classmates. I see Dr. Harvey in the back and Dr. Benson is here. So I understand some of you started families or continued families while you're in dental school. How many of you have young children, babies? Put your hand up, it's okay. So I did too, and it gave my graduation a whole new meaning when it came to a pregnant moment. So my final year of dental school, I was, as you heard, class president and pregnant with my first child, Stephen. And graduation was scheduled for a beautiful Friday afternoon, a day like this in June. And that morning I went into labor. So around noontime, I went up to the hill where the graduation was going to occur, and I told the dean of students I wasn't going to make it. I was 90 degrees bent over, so any of you who have been through labor, you know what I'm talking about. So as my husband and I went to the hospital heading north, my entire family, I have a huge family, they all headed south, went to the graduation. My mother accepted the diploma for me, and then she had the nerve to tell me later on in my life that it was the easiest degree she ever obtained. And they actually had a graduation party without me. At about midnight, my husband came back with a little cupcake, which didn't help me much. So, like my graduation, the lesson here is all of life's plans do not always pan out the way you want them to. And I guarantee that somehow, somewhere, some point in your life, you will have to make a decision as to what to do, whether it be in your personal life or your professional life, that will be difficult. Today, everything seems to be going as planned. You've graduated, you're going to receive your degree, and everything you've earned symbolizes your ability to make really smart decisions, and your expertise, your commitment, your drive, and most importantly, your leadership is all evident today. And one of the hallmarks of leadership is to know when to roll with the punches and when to stand up for what you believe, when to sit back and when to lean in, when to let go, and when you need to give it all you've got. So as a dentist, you are a leader. You're the leader of your team, you're the leader of your patients. Many of you will lead your communities, your profession, to serve the greater good. And leaders, by definition, are the people who can influence others to follow them towards the achievement of a common goal. Among all the strengths that true leaders have to have, the most important one is a foundation of trust. People trust us. They believe that we have their best interests at heart. And as leaders, we have to continually act in a way that inspires trust. The research literature demonstrates that a state of trust brings better results, better teamwork, better culture, higher morale, better decision-making, more innovation, and loyalty. And trust is not something we're all born with, but it can be learned, and it can be developed as a strength. So our title, doctor, is insufficient to earn trust. We need to practice it and live it by little behaviors every day. Things like never talking about someone behind their back or criticizing others without the courage to take the issue directly to them. When trust is absent, we pay a terrible price. We perform poorly, we blame others, take credit for work we didn't do, backstab, gossip, no teamwork, no collaboration, no information sharing. Fearful defensiveness, it just doesn't work out well. So if trust is critical to success, how do we earn it? And the one question I want to ask you is to never, ever forget why you got into this school and why you are entering this profession. Is it to help others or is it to help ourselves? That's a critical question to answer. And while the answer may seem obvious right now, as doctors, you're going to find out you are faced with dilemmas that are routine, that test to resolve, and are the ultimate test to who we are as people, as members of our society. The way we choose to respond not only matters, but it shapes our community, it shapes our profession, it shapes the world we live in. So the stakes are high. As a new practitioner in the early 80s, this is revealing how old I am now, I was the only dentist in my hometown, Medford, Massachusetts, that was willing to treat HIV-infected patients. Now, this was in an era of fear and misinformation, and an AIDS diagnosis was a death sentence. We know now that people live long lives in good health because of research and medication. But I was criticized by my peers for endangering my patients and my staff and my family, and yet I felt compelled to act on what I thought and believed was in the best interest of my patients. So we live in a more tolerant world right now. And I found that letting values guide us, rather than the opinions of others, is generally the right thing to do. And in this case, even when many of my colleagues that I respected most told me I was asking for trouble, the things that I believed in and aspired to, which personally my values include integrity, optimism, and resilience, and of course trust, helped me make the right decisions. And even as many of my chronically ill patients became unable to pay for the care that they were receiving, I continued to care for them. And I did just fine. And paying it forward has incredible rewards. So in the long run, living true to your values earns trust. And don't underestimate its value for enabling you to live the life you want. Your future is the future you create, and it depends on the kind of leader you decide to be. We all have freedom. We have freedom to make choices that impact our ability to lead, to practice, freedom to work hard or not, freedom to care about people or not, to be intentional and determined or not. You have chosen caring and determination above all else. You have chosen to transform lives, to live the values of integrity, resilience, and courage, to be who you are and to build the future you want. When I got started in dentistry, so much of what we now take for granted hadn't even been imagined yet. Very few women, smart restoratives, preventive materials, electronic health records, digital everything, smartphones, social media, perfectionist dental aesthetics. Everybody is at least A1. Mega multi-state group practices. None of these things were imagined when I was missing my graduation. But every one of these changes or advancements was decided on and willed, planned, and executed into existence by people who chose deliberately to act. People like us built the world we live in today and the normal we now take for granted. They had a vision for the future and worked to make it so. So I challenge each of you to be the kinds of leaders that act and inspire those around you, to join you by cultivating trust so that we can work to build the new normal, your future. We have a vision at the ADA. It's fairly new. It's to empower dental professionals to achieve optimum health for all. We believe in this vision, and we believe in you. We trust that you will do whatever you can to help our society, our profession, and realize that vision, that everyone Everyone should have optimum health. This profession of 161,000 dentists represented by the American Dental Association is extremely proud of you. Now trust in yourselves, trust in your future. You dream it and it will be so. You have proven your worthiness for lives of compassion, impact, and meaning, and I want to welcome you to the greatest health profession on earth. Welcome.
Thank you, Dr. Olafen, and thank you again for being here with us today. Our students spend 3 years as one of 4 clinical group practices. Caribou, Denmark, Eastport, and Farmington are their names. The students and the group practice leaders get to know each other very often very well over the time, with their group practice leader becoming their primary guide and mentor. Each student will be hooded by their respective group practice leader. Placement of the hood symbolizes the completion of the Doctor of Dental Medicine degree. Today, we will also present each graduate with a certificate of dental public health leadership in recognition of their completion of a special emphasis in public health. As each graduate exits the stage, they will be greeted by the Maine Dental Association President, Dr. Gary Kreischer, and welcomed into the College of Dental Medicine Alumni Association by one of our alumni, Dr. David Velick, class of 2017, and former class president. We would like to invite the special family member or guest designated by the graduate to meet the graduate after they exit the stage to your left, over here. The special family member or guest will present the graduate with a rose, and a photograph will be taken. When the name of the respective group practice of your graduate is announced, please proceed to form a line at the designated location on the left side of the stage area where you will meet your graduate. I would now like to invite Assistant Professor Dr. Michelle Sau to present the graduates. Would the Marshal please escort the Doctor of Dental Medicine candidates to the platform for the hooding?
For the Caribou group practice, I invite Dr. Michael Truscott to hood the candidates. Would the candidates please step forward? Colleen M. Ahern, Central Islip, New York. Audra A. Boynton, Windsor, Maine. Maeve Elizabeth Daly, Ann Arbor, Michigan. Andrew C. Greenslade, Pine Island, Minnesota. Mary Pauline Hand, Bow, New Hampshire. Shauna Hott Huffman, Lawrence, Kansas. Priya Chandrakant Kotwala, Bloomingdale, Illinois. Michael D. Katz, West Hartford, Connecticut. Benjamin Everett Lacey, Charlottesville, Virginia. Jonathan Brandon Nutt, Londonderry, New Hampshire. Cherith Rose Rays, Norway, Maine. John S. Skavorak, Windham, Maine. Shadbi Nazanin Tagizadi, Winchester, Massachusetts. Corey J. Wells, J. Maine. Alexandra Zach, Syracuse, New York. For the Denmark group practice, I invite Dr. Jay Boschman to hood the candidates. Would the candidates please step forward? David A. Annika, Raymond, Alberta, Canada. David was unable to join us this morning. Robert G. Belanger, Clinton, Maine. Christopher Curtis Burns, Dayton, Ohio. Anuja Atul Chumble, Martinsville, Virginia. Justin Patrick Feehan, Haymarket, Virginia. Andrew McBeath Harvey, Portsmouth, New Hampshire. Molly Ann Kalish, Beaumont, Pennsylvania. Luke Robert Klinker, Madison, Maine. Erica Ann Canar, Westbrook, Maine. Christopher R. Logan, Chelsea, Maine. Rishi Fakey, Madison, New Jersey. Tara L. Prasad, Lincoln, Rhode Island. Zachary K. Regan, Kennebunk, Maine. Benjamin D. Roberts, Wakefield, Rhode Island. Jessica Pillsbury Smith, Sydney, Maine. Salome Zangalazi, Morristown, New Jersey. For the Eastport group practice, I invite Dr. Jeffrey Feingold to hood the candidates. Would the candidates please step forward? Caitlin Allen Tobolski, Green Hills, Pennsylvania. Leah Celeste Bollier, Gorham, Maine. Chandler Joseph Bullock, Fillmore, Utah. Christopher Joseph Castongwe, Etna, Maine. Hillary Ann Creed, Mendon, Vermont. L. Marie Donnelly, Annapolis, Maryland. Nicholas McGuire Guy, Hollywood, Maryland. Michael David Holbert, Ogden, Utah. Emily Elizabeth Hyatt, Cary, Ohio. Lydia B. A. Gleason, Williamstown, Vermont. Kate Imelda Maury, South Portland, Maine. Anthony John Preisler, Dudley, Massachusetts. Ryan D. Salomon, New Berlin, Wisconsin. Reverend Peter Andrew Verplude, Nottingham, New Hampshire. Robert Walsh, Charlestown, Rhode Island. For the Farmington Group practice, I invite Dr. Courtney Shapira and Dr. Lionel Vachon to hood the candidates. Would the candidates please step forward? Kirsten Sierra Barrett, Nashua, New Hampshire. Megan Margaret Bradley, Newburyport, Massachusetts. Joshua Mark Cambridge, Sacramento, California. Wesleyan R. Deibner, Wyoming, Illinois. Tyler Joseph Gangen, Sabatis, Maine. Jessica Lynn Hines, Waltham, Massachusetts. Swati Krishna Kulkarni, North Brunswick, New Jersey. Alyssa Michelle Liebsite, Fond du Lac, Wisconsin. Matthew Paul Meredith, Emmetsburg, Iowa. Peter D. Pellegrini, Kingston, Massachusetts. Christine Emily Rainitz, Glenview, Illinois. Arena Sorokina, East Greenwich, Rhode Island. Curtis Allen Thibault, Madawaska, Maine. Francesca Vargas, Nashua, New Hampshire. Daniel James Waller, Heartland, Wisconsin. Minjin Lee Yu, Fairfax, Virginia.
The class of 2018. Please be seated. I remembered at that time. I'd like to now welcome Hillary Creed, our president of the class of 2018, to address the graduates and lead the graduates in the Dentist Pledge.
Students, faculty, family, and friends to the hooding ceremony for the College of Dental Medicine Class of 2018. On behalf of the Class of 2018, I'd like to take a moment to thank all of the faculty, administration, and staff who have supported us during these past 4 years. We are thankful for all of your encouragement and guidance and could not have successfully grown as student doctors without each and every one of you. As a parting gift to show our appreciation and gratitude to the college, the Class of 2018 has donated additional shelving for the Comprehensive Care Clinic Wet Lab. Dr. Ryder, could you please come forward as we present this gift to the college? Hey!
Oh, nice.
We would also like to take a moment to thank all of our deans for supporting our class during our time at UNE. Would Dr. Kimmis, Dr. Ferrier, and Dr. Coble please come forward? I'd also like to take this opportunity to recognize all of our friends and family who have stayed by our sides and remained our biggest support systems during this dental school journey. Thank you all for your optimism, continued reassurance, and most importantly, patience during our educational careers at UNE. When reflecting back on these past 4 years, what really stood out was a marked shift in our decision-making as we progressed through the different stages of our education. First and second year focused on decisions that affected our personal academics and well-being. Do I go straight to the library after school, or can I go to the gym for an hour? Do I have time to make dinner tonight? Can I afford to sleep, or should I pull an all-nighter and cram for my 3 exams tomorrow? As we entered patient care in our 3rd year, our choices started to revolve around a more clinical mindset. What materials would be best for this procedure? What instruments do I need? And most importantly, do I know all the actual steps, or should I review some notes? Shout out to YouTube. In our 4th year, after getting more comfortable making practical decisions about the work we were doing, we started to incorporate decisions about what is best for our patients. Is this the optimal treatment for this patient? Have I evaluated all the variables necessary to make a successful treatment plan? Have I truly listened to this patient? Will this patient leave the office today better than they walked in? Prior to leaving for my first clinical rotation of my 4th year, a patient gave me a card to mark my transition to patient care outside of the school setting. Inside the card was a dancing duck exclaiming, "Congratulations," with a poem which read, "Do all the good you can, by all the means you can, to all the people you can, for as long as you can." Then the patient wrote, "Remain humbled by your beginnings. Take care." The words resonated with me. I knew I would need to heed the advice of the dancing duck and take these words with me during each step in my career as a provider. Class of 2018, we must do all the good we can, by all the means we can, to all the people we can, for as long as we can. We must be confident in our education from UNE and appreciate that we are prepared to make the right decisions as healthcare professionals. We need to remain humbled by each success, adaptable to adversity, and keep in mind that each decision we made must be made for our patients' well-being. We must remember that the choices we make define us. We must choose well. I have been honored to share my dental school experience with each and every one of you for these past 4 years. I would like to thank you all for allowing me to represent you, as I have enjoyed each moment collaborating with the rest of student government on your behalf. Good luck in the next steps of your dental careers, and please stay in touch and connected with UNE as we continue to grow and learn as practitioners. Remember, choose to do what's right, remain humbled by your beginnings, and take care. We will now take the dentist pledge. So if you could all repeat after me. I, dental student name. Yeah! As a member of the dental profession, shall keep this pledge and these stipulations. I understand and accept that my primary responsibility is to my patients. And I shall dedicate myself to render to the best of my ability the highest standard of oral health care and to maintain a relationship of respect and confidence. Therefore, let all come to me safe in the knowledge that their total health and well-being are my first consideration. I shall accept the responsibility that, as a professional, my competence rests on continuing the attainment of knowledge and skill in the arts and sciences of dentistry. I acknowledge my obligation to support and sustain the honor and integrity of the profession and to conduct myself in all endeavors such that I merit the respect of patients, colleagues, and my community. I further commit myself to the betterment of my community for the benefit of all society. I shall faithfully observe the principles of ethics and code of professional conduct set forth by the profession. All this I pledge with pride in my commitment to the profession and the public it serves.
Thank you, Hillary. Thank you, class of 2018. I guess you're not a class anymore. I just have one last bit of advice for the class of 2018. When I walk into the office of our founding dean and now executive associate dean, Dr. Jim Coble, there's a sign on his bookshelf that says, "Be kind, no exceptions." And while the irony of demanding one to be kind is a little bit of the funny part, the sentiment is one to be taken seriously. Never forget to be kind, especially to your patients. The patient comes first, even those patients that you don't especially care for. Be compassionate, be empathetic, and put yourselves in their shoes. Ask them about themselves. Tell them a story about yourself. The more we understand about each other, the less likely we are to be suspicious or fearful. What we have in common with each other greatly outweighs our differences. Congratulations, class of 2018. You are now doctors of dental medicine. Before we conclude the program, I'd just like to make a few announcements. Please join us through the doors to your right over here for a reception and celebration of today's events. I'd like to take this opportunity to thank our dedicated student affairs team and staff volunteers led by Travis Erickson and the team from Conference Services and Sodexo for making this ceremony possible. And also thank you to Portland Brass for the wonderful music that you've provided us. And I'm going to thank you for last year, too, because I forgot to thank you last year. I'd like to ask our guests to remain seated as the platform party, faculty, and students recess to conclude the ceremony. And again, congratulations to all the graduates in the class of 2018. Thank you so much.